This is a video clip of the Nottingham Faster Turnover pathway in action. Theatre turnover time, or surgical non-touch time, is normally defined as the time between the last patient leaving theatre to the next patient entering the anaesthetic room. For this video, we define theatre turnover time as the period after the last dressing applied on the patient on table to the completion of lens check and timeout part of the WHO checklist for the next patient. In my opinion, this is a better way to measure efficiency for surgery under local anaesthetics, as it measures times that we're not actually operating. To make things more interesting, so to speak, we have a locum surgeon using the pathway for the first time. All our patients are having subtenon block for their operations. We will demonstrate how we can turn over theatre in under 7 minutes despite these constraints. We are using an area in the day case surgery unit to perform our blocks. We have an anaesthetist and an ODP running this area. The block is performed while a patient is on table in theatre. Patients on our high volume cataract list are normally operated on under topical anesthesia only. For this video, we wanted to demonstrate that the pathway can also apply for patients needing a block. Preparing the surgical tray in advance is a key to being efficient. Doing so allows the workstream to run in parallel, and scrub team can set up for the next case in their own time. Even colleagues who take a bit longer to set up their trays can run this pathway. To do that, you need a surgical prep room with sufficient air change. In Nottingham, like a lot of trusts across the country, our theatres are designed without dedicated surgical prep room. We go around this problem by using our anaesthetic room as a prep room. We are using a laminar flow machine to create a sterile field over the surgical tray to mitigate infection control issues. In this pathway, the theatre team consists of 2 scrub nurses and 2 runners. The video starts after the last dressing has been applied. This video has no sound. In the block room, subtenon block has already been performed while the last case was on table. You can see how our staff is not rushing around to achieve a quick turnover time. There is no pressure on the staff to work any faster than they normally do. Back in the block room, we are now taking our time getting the patient comfortable on the operating trolley beforehand. This pathway is suitable for patients with mobility issues or have problems with lying flat. Patient's care is not compromised with this pathway. Our runner is taking his time explaining to the patient that he is about to be set up on the operating trolley and that he will be brought back to the ward. Our patient left theatre at 1 minute 40 seconds. Our locum surgeon is writing his surgical notes and completing the digital records. The remaining runner is getting theatre ready for the next case. When she is ready, she will let the scrub nurse in with her surgical tray. As the tray is already set up, the only job left now to do is setting up the phaco machine. You may be wondering why we still haven't left the block room yet. What we were actually waiting for is for the last patient to pass through the corridor just in front of the block room. We will leave for theatre as soon as the last patient has come back. You may have noticed some marks on the floor in the operating theatre. We made those marks at the beginning of the list to remind us where to position the operating trolley. If you're wondering where the next patient is gone, we're just taking our time taking the patient down the corridor slowly. Patients can get motion sickness if we push the trolley too fast down the corridor with them lying supine. Our patient enters theatre at 3 minutes 35 seconds. It took almost 2 minutes between patients because the block area is about 50 meters away from theatre. The video will now be sped up until the next point of interest. At 6 minutes 10 seconds, we are ready to perform timeout part of the WHO checklist and lens check against the biometry. The importance of getting this right cannot be overstated. Patient safety must never be compromised. And at 6 minutes 40 seconds, the patient is ready for surgery. There are a few areas we can work on to make this pathway even more efficient. The key message, however, are that number 1, you need a surgical prep room to be efficient. If you haven't got one, then consider using your anesthetic room as a prep room and use a laminar flow machine to create your sterile field. Number 2, patient safety and care must not be compromised in any way. Number 3, efficiency can be achieved without putting stress on staff to work quicker. It is all about teamwork. If you would like more information or see the pathway in action, please get in touch.